interesting patient who had a previous distal biceps tendon tear. After the tear, the patient underwent surgery, and unfortunately, he had a re-rupture of the distal biceps tendon. So a second surgery was performed, and after this second operation, the patient developed a sensory loss at the level of the mid-distal third of the ventral forearm, the territory of the lateral cutaneous nerve. So now we go and check the lateral cutaneous nerve. We place the probe in a transverse plane in between the biceps. This is the biceps muscle, and this is the brachialis. So in the middle, we see a cleavage plane and the fascicles of the distal musculocutaneous nerve. So we follow the fascicles down, and we see that the fascicles moves towards the lateral border of the biceps, and then the fascicles become some more superficial here to move into the subcutaneous tissue. On the medial side, we see a huge myotendinous junction of the biceps following surgery. The fascicles here pass over the biceps tendon, and then they move towards the medial side of the repaired tendon. So they change completely their position. So basically, we expected to have the fascicles on the lateral side of the tendon, but we see that they cross the tendon and they move alongside the medial aspect of the biceps. So this is the level of the suture, the level of the injury, and we see the fascicles of the lateral cutaneous nerve entering the tendon substance and interrupted here. So more superficially, we see other nerve bundles. This is a neuroma related to the distal stump of the lateral cutaneous nerve. If I go more distally, I see the fascicles as they distribute to the skin on the ventral radial aspect of the mid-distal forearm. This is another terminal branch of the lateral cutaneous nerve, and we see that this branch is disconnected as well. So in this case, there was a complication of surgical repair of the distal biceps tendon. The lateral cutaneous nerve of the forearm was entrapped at the level of the suture here, and so we can see the nerve entering the tendon substance and interrupted in this area.